one of my gorgeous clients who's basically a little canvas here. She comes in maybe yearly for just little touch-ups. Doesn't really need that much, but the thing is, because of these small treatments, she literally doesn't age. She just looks really beautiful, and all of her facial features are contoured and are defined. So we're gonna focus on very small precision. I'm almost gonna call this precision filler, because we're gonna work on small areas like projection in her middle face, a little bit in contouring in her chin, giving definition along the border of the jawline, filling in small amount of submalar hollows, and blending in the temples and the eyebrow. So I'm gonna focus first and starting from the top down, we're gonna work on just some foundational filling. We're gonna work on the temple here, just a small amount with Radiesse. This is gonna give her a little more structure. The reason I feel like she's had a really good result that's lasted is because we're choosing the right fillers and we're doing small amounts in each area. And we're kind of blending the areas. And we're gonna work to use other filler around it. So this base filler, so you're gonna come on this side, hold from the top. This base filler Radiesse is going to contour and build structure to that area. And then we're gonna go on top, and almost like frosting on top of a cake, we're gonna use a hyaluronic acid to blend her brow and the other parts of her temple and around her
Someone's
eye.
asking if they're using Radiesse. Yes, we are right now. We're going to switch off to different fillers soon.
So again, just
Josh says happy Tuesday.
Hey. So we're working on just fine-tuning some small areas here that she has, we need to blend on the temple, because she already has nice volume, but look at that temporal fusion line, which was here, creating a little indentation, is now gone away. So you're gonna hold from behind, you stay behind. Hold here, good, stay there, hold that. Now, since we're using the Radiesse, I'll finish all the Radiesse. And I'm gonna use some of that along her jaw. You guys want to grab this? So she has a really beautiful 90-degree angle already in some size, but she really wants some tightening along and some straightening along the jawline here. So using a small amount of the filler, we can really define out this border and make it really what I call crisp, very defined. Okay. It always looks a little bit more substantial immediately because this filler has a little more volume, but also because we're doing a lot of needle pokes. In like a week, it looks unbelievable because all of this is defined. Okay, even if you come from the side now, take a look. It's like as sharp as a knife.
That's pretty.
So you're gonna come on the other side now, you're gonna Q-tip the jaw. You're gonna come back. We're not using a lot of filler, we're just defining exactly where we need it. So again, you see where the edge of her masseter is, right along the jaw. Just doing a little bit. This is your fine out. And you can do this with a cannula as well. And this just gives a little more straightening.
What is the difference between Restylane Lift and the filler used in the temples, which is
Very
Radiesse?
different. One is hyaluronic acid, the other is calcium based, which is Radiesse. So we have Q-tip on the other side. So I'm gonna let that sit a second. We're gonna work our way back up to the brow. And we're gonna do my signature sort of brow lifting with cannula. So, hold on. Perfect, hold on. Okay, go ahead. So we're gonna use another Restylane product here. I know someone was just asking about lift. Now she's very specific on her brow, okay? We have to go middle. We gotta get this midline lifted. So we're working our way all the way over. And we're gonna bring this forward a little bit. Now, we could use a mesh. You guys know I was in Miami this weekend talking about mesh fill. We could use that here if we wanted. We're working just with the filler right now. You guys see we're going right in the back of the brow. As you age, you lose a little volume. Some people like a little more projection here. So we're working our way right on the brow, right on the bone, lifting this area. Okay, you can see it. Okay, now we're gonna kind of blend because she was asking me to blend a little bit in the temple. So we're gonna blend a little bit with the hyaluronic into the temple and forehead area. So you guys see, I'm using the filler here to blend all the way up into the temporal fusion line, into the forehead a little bit. Okay, just massage that. And you guys can take a look at how soft it is.
Oh my goodness.
So you can see now, look at the difference in the one side. It's more projected, it's more lifted. It has a lift from the center all the way out, which a lot of people tend not to do. They tend to only go to lateral third. She really wants it all the way across, which is fine.
Oh my gosh, she gave her a brow bone.
She got a brown bone, exactly. And that's why the mesh fill does really great as well. Which we talk about a lot again. We're gonna go all the way down, straight across, perfect. And that same thing, let's start filling and lifting on the brow. So what are they saying there, Jordan? Nothing. They're so in awe. And she's so beautiful, so that's why. So we're working nice and slow. The good thing about this, very minimal pain, and has almost no risk of damaging blood vessels or nerves, because you're literally using a cannula right on the bone. So we're gonna blend a little bit now. Like I said, I promised her, do a little bit on the forehead so you guys can see where my cannula is. Blend in the forehead, okay? Submuscle. It happens at the end of this cannula. This filler is thick, so at the end it pops. Okay, so now, nice blend. Look at that beautiful forehead.
So wants to know if we can please do surgeries in Boca.
We eventually will, don't worry, we will, very soon, very soon. So now we're gonna work on the apple of her cheek, and I think it's really important to talk about this. Not all girls want lateral elevation. Some of them like this anterior projection. So we're gonna focus on her anterior projection. It really helps her under eye, her folds. Okay, and it really gives a nice balance to her OG curve. Perfect. And if you come to the side, this is where you really can see it. Look from the side. That's
What is the chance the filler migrating in the brows?
none. With the Botox that we do and using the cannula, she's totally fine. So again, doing that same thing, coming more medial than you would anticipate. Beautiful. So again, focusing on that anterior portion and not going too lateral. Okay, come massage on that side. Beautiful. Now I'm going to work a little bit on her chin and folds. Okay. So with her, I want to create more of that heart-shaped look. I want more slenderization and definition. So I want to focus on bringing this chin forward and straight. And really giving it a sculpted look. blend slightly on her fold. And if you see, now, I love this. If you look from the side, this is a little bit of swelling from the injections. This is a little bit of swelling from the injection. If you take a look now from the side, look at the height, look at the where the light is balanced is bouncing off of. Right here in the mid cheek, right here, right there. All perfect. Nose, lip, and chin balancing out perfectly. Now I'm gonna work on one special area for her that she notices a little bit is through here. Some women get this little bit of this sort of malar hollow. We're just gonna put just a small amount of filler here. I don't wanna overdo this because I don't want her to look overdone. And two, but we use a little filler just to blend in here. Good. And that's going to kind of fill in where some people tend to look a little bit hollow as they get older. This will make her look a little bit more full. Okay, come over here and use Q-tip. Right here. Right here. Beautiful. Now to blend everything, I'm going to do just a small amount on her under eye, using a little Restylane, because it will blend really nicely with the filler we just did in the cheek. And she doesn't need much. Again, a little more to the fold. And then you can see, look how straight this looks now. Same thing right here in her eye area. Just a little bit to blend and get those dark circles, but also kind of blend into what we're doing here with the cheek. Really pretty. And then lastly, our favorite part, the lips, our favorite part. But she requested today to have a little bit of a keyhole. So what I want you to do, you're gonna hold this for me right here. Okay, we don't normally do this as much anymore. We used to do this all the time. We're gonna hold this here. You can use a floss. You can do anything. We're gonna create, look up with your chin just a little bit. Perfect. We're gonna do a little bit more of a keyhole fill. So this allows the filler to kind of stay in position. Create more of a shape. Good. So I'm gonna keep it there. Switch. We're gonna stay with that there. Hold on. Let's go. Okay, good. Good, go ahead, switch. Hold right here. Good. Straight though, straight. And again. And then with her lips, I just want to give a little definition on the borders. Good. Okay, you can take the Q-tip down.
That's really pretty.
Now let me see from the front, hold on. And now look at the keyhole.
What kind of filler are we currently using?
This is Volbella, which I like. It's a softer lip filler. And it just gives nice shape, because look at her lips now, look at the eversion, look at the eversion. And look at the keyhole now that you wanted. Okay, so let's take a look at how it all came out. Let's show her. Obviously there's going to be swelling, especially along the jawline. This area tends to be, always get the most swollen through here. So I always tell people kind of ignore that for a week or two. But overall shaping, more medial, more, do you want to give her the Emer reveal?
We can do that.
Alright, let's do the Emer reveal. I can't wait to see this in like a week,
Me too.
Oh yeah, it's gonna look really good.
because it's all going to settle in perfectly. Alright, we're going to give you the phone so you can take a look, okay?
Grab
Take
it.
a look, grab the phone, grab the phone. Little swollen,
God, I love your
obviously,
crazy
but
pretty lips.
Thank you. I love it.
They look normal.
look,
your
and I want
brows.
you to see though, look through here, the lifting there, look at the brows now.
Yeah.
More lifted, more blended, there's no hollowing,
Maybe I
forehead,
brought
and now look on the side, look at the jaw, all the way straight along the jawline. What were you wanting to achieve?
It's cute. I love it.
You wanted to look cute. Okay, perfect. That's great. So now show her in the mirror. Show her in the mirror. She wanted to be sculpted. You feel sculpted? Good. Okay, you guys. So we did female facial sculpting. In a week or two, it'll all settle and it'll look great. Stay tuned. Let me look at you from the front. Yeah, it's gonna be really good.